Hi everybody, Ziv Simon here. I'm the creator of Surgical Master, the surgical training for dentists. Welcome to a three-part video series on a case that I treated recently in my practice. And if the title looks a little bit unusual, no worries, I'm going to explain why I called it the bad canine and what was so tricky and interesting about this case. I first posted a periapical radiograph of a canine gone bad, and I called it the trouble in the aesthetic zone. And it created really good discussion, a lot of comments about this case, a lot of suggestions of what needs to be done, what not to do. And I immediately knew that this is a case that a lot of doctors would be interested in. And that's why I created this three-part video series. And in this video, I'm going to talk about the challenges that are associated with this bad canine. In part 2, I'm going to show you the virtual surgical plan as I go over the CT scan and plan my surgery. And in part 3, I'm going to show you the different steps of the procedure and how exactly I overcame some of these challenges. So when you think about upper canines, these are teeth with long roots, with very good prognosis long term, and they're also very important for the occlusion. Now, when these teeth with big roots fail, they can also fail in a big way. And that could create some challenges, especially because it's in the aesthetic zone. So this patient initially presented with an infected canine with massive bone loss on the mesial aspect, between tooth number 6 and 7, and bone loss that extended to the level of the post. There was also some collateral damage on the lateral incisor. So there was significant bone loss on the distal aspect of the lateral, and also a small periapical lesion. The other thing that is of notice is that the canine is in close proximity to the maxillary sinus, and that's relatively unusual for the maxillary sinus to extend that much mesially, but it does happen every once in a while. So we have to keep this in mind when we think about the next steps. So the decision was to extract the tooth. The prognosis was hopeless, and there was a question mark about the lateral incisor because there was significant bone loss, luckily no mobility, and this tooth had a questionable prognosis. So when you are presented with a situation like that, you need to anticipate a few things. Once the tooth is extracted, you will see a very significant vertical defect, and also the horizontal dimension will be diminished. You can anticipate worsening of the lateral incisor, and maybe even the loss of the tooth in the future. You can expect some aesthetic compromise because of these two issues. There'll be some tissue loss and bone loss, and that can affect the aesthetics of the smile. And also when it comes to implant replacement, you will be limited in the vertical dimension because of the position of the sinus. You can expect the need for some sinus augmentation, and also be aware that when you extract the tooth, because of the periapical infection, you may have a sinus communication. So there are a lot of challenges with this case, a lot of things to consider and plan for. Now, unfortunately, or maybe fortunately, this patient was first seen by an oral surgeon who extracted the tooth and augmented the site, preserved some of the alveolar ridge, and he did an excellent job. The area healed without any problems, and the bone height was increased compared to the baseline. But what was very impressive and also very important is that the lateral gained some attachment in the process. And that not only improved the prognosis of the lateral, but improved the prognosis of the whole case in terms of implant placement and also the aesthetics. So this patient was referred to me after the bad canine was already extracted and the ridge preserved. And if you look at this patient's smile, he has a low smile line. And from a lateral view, you can start seeing some of the aesthetic challenges. So although this patient has a low smile line, he does show the interproximal tissue. And this tissue is missing on both adjacent teeth close to the canine site. And I also noticed that the mesiodistal space, the restorative space for the canine, is increased. And that's another potential aesthetic problem that needs to be addressed. The patient was all in all periodontally healthy. And looking more specifically at the implant site, you can start seeing the tissue deficiency. There is recession on the lateral incisor, and the tissue on the proximal surface of both adjacent teeth is missing. And you can tell that there's something abnormal in the mucogingival condition. You see that the mucogingival line is displaced coronally, and there are signs of vertical releasing incisions from the previous procedure. Now, I measured a mesiodistal space of about 11 or 12 millimeters, which is increased for a canine, which is going to be a restorative challenge. But from a bone perspective, there's definitely a buccal deficiency, and the ridge resorbed horizontally, yet preserving a fair amount of good attached and keratinized tissue that is going to help us in the next phase. The better the tissue, the more options we have, and usually a better outcome. It really helps to look at study models and assess some of the orthodontic problems. It'll help you to create a wax up and assess the restorative space and also plan the ideal implant position. Now, for this patient, not only did we have increased space for the canine, there was also some other spacing between the premolars and also in other parts in the mouth. And at this point, you don't have to commit to a final implant position. Really take your time, study the case really well, understand the patient's concerns, wishes, and goals. Determine what can be realistically achieved. Discuss this with your patient, including some of the aesthetic challenges, and only then come up with a treatment plan. Part of the treatment planning process is evaluating the implant site. And we already looked at the periapical radiograph and we saw good healing with bone levels that were augmented to some extent and an improvement in the attachment on the lateral. But we also noticed the proximity to the sinus and good thickness of soft tissue. The next step is to look at the CT scan at the three-dimensional view of the site. And in part 2, I'm going to get into the details of the CT scan analysis and how I use my software to virtually plan the procedure, the implant positioning, and the sinus augmentation. So this concludes part 1. I showed you a patient that came in with a bad canine that created so much collateral damage to compromise the adjacent tooth, the lateral incisor. The infection around this canine compromised the surgical site in all dimensions, and in addition, there was a pre-existing sinus proximity. And on top of that, there are some restorative challenges with spacing issues that can compromise the aesthetics. So definitely a bad canine, an evil canine that created a lot of damage and a big challenge for me and the doctor treating this patient. So I hope this was valuable and interesting to you. I look forward to seeing you in part 2, where I'm going to show you the virtual drawing board and playing with my computer software to plan the surgery for this patient. And I believe that once you understand the challenges, know some of the options, and learn about some of the techniques that I'm going to share with you, you'll be able to address similar situations in your own practice and help your patients and be a great surgeon. So I look forward to seeing you in part 2.